up and down in hospitals, at home, everywhere in the cities, every time here and there. And it's a nice, hustling is nice. Hustling is nice, my friend. Hustling is nice. And I've been doing some manual work in the morning. You saw me going to get a haircut, and then after that went to hospital and then to rush to see something. So today, welcome. Start. We're still working on the heart, matters of the heart. Matters of the heart, and matters of the heart, you understand. Matters of the heart includes matters of the heart include me and you, and not the emotional or matters of the heart. We are talking about physical, how the heart, the physical heart, this heart, how this heart, how that heart is affected, and it affects your life. So welcome, my guys. Welcome, guys. I see someone is still here watching and feeling nice. As you come in and you are watching me and you are looking at me, smile with me. Smile with me a bit. Just come to the chat and tell me, hey, dog, I can see you there. I can see you. And I'm watching you from Africa. I'm watching you from this and this place. So you, my guy, man, don't just watch me and listen. Let's be interactive. Where are you watching from? Where are you chilling at? Which side of the world? Because I can't say the country. I've watched all over the country. Which side of the world are you watching from? I'm Dr. Ben. The channel is called Benjamin the Wise Guy. Because being wise is helping people maintain good health, is helping people maintain good health. So you who is there and you have a question of mental health, physical health matters, you come here and tell us, I want us to discuss, doc, I want us to discuss this. It is health. Is it health? Should we do this? Having a channel like this is not my channel. Is an interactive channel. Is an interactive channel. I can see Miriam Mumbo, Miriam. How are you doing? How are you doing, Miriam? How is the day where you are? And interactive sessions are good, and we talked about kicking away heart attacks. We don't want to get shocks and heart attacks. No, we want to live healthy. We want to live in a good situation. We want to live like how God brought us, kings and queens. God brought us to the world to enjoy. God did not give us the world to suffer. No. So welcome, my friends. We talk about diseases and we talk about how to stay away of those diseases. Dr. Ben, have been having headaches for 2 weeks. Have you visited a physician or a doctor, Miriam? 2 days. That is complicated. Have you visited a physician, Miriam? If for 2 days, you should check your BP. You should do, if it continues, your BP is not high, it's normal, you should check something that is called a full hemogram. Check your full hemogram. Let the doctor advise you, because headaches for 2 weeks, maybe if there is something wrong or something is you have something that is disturbing you mentally. You see, when you have something disturbing you mentally, it can be a problem. But tell me if you have visited a physician or you are just taking painkillers. If you are having BPs for that long, please don't rely on painkillers. Sandra, Sandra, how is you, Sandra? How is the going? And Sandra F3F2I, how is the going? Which part of the world are you watching me from, Sandra? Welcome to this channel, and let's get interactive. Today we want to talk about other diseases of the heart. We have been taking painkillers. That is now not okay, Miriam. If you have been having headaches for too long and you're just on painkillers, they may bring more problems. So my advice is, where you are, find a physician, find a hospital, tell them you've been having headaches for 2 weeks. check check on your BPs, check on your blood pressure, check on things that may make you to have, maybe you have acidity. Your acidity can make you have headaches. Maybe you have issues that are coming through, they can make you have headaches, you see. So welcome our new friend Sandra. You are a new friend, or you are our long time friend, watching from Nairobi. I'm in Nairobi, Sandra. Even me, I'm in Nairobi. But today I've been away out of town doing. If you watch my early morning videos, I've been away doing some chores somewhere, up and down. I was in the hospital. In the hair, I started by a haircut hospital, and then. So welcome everyone. Miriam, please don't continue taking painkillers. Visit a physician and let the physician advise you on good ways of managing your headache. Headache is always a symptom that something is not right. So don't persist. Yes, at your project. Yeah, there's some work that was going there and I was not feeling it was done the way I want. So I had to leave work and rush to go and check how the work is going on. So people, today let's discuss about cardiomyopathy. When I say cardiomyopathy, someone will tell me, Doc, that name is a big name, doctor. That name, cardio, I said it means the heart. Myopathies means a group of diseases. Groups of diseases that affect the heart. The groups of diseases that affect the heart. I think we should add there heartbreak. When I'm adding cardiomyopathies, the groups of diseases that affect the heart, I think we should add their heartbreaks, because many people and they have problems with the partner. You'll say, don't heartbreak me. Yes, don't give me a heartbreak. So I think heartbreak, social, interactive heartbreak, should be placed as one of the major causes of cardiomyopathies, the problems of the heart. So what are the problems of the heart? As you come in, I can see Miriam, I can see Sandra, I can see you that you're coming in and going. Don't just come in and go. Come in, subscribe, tell me where you're watching from. Like you see, Sandra has said, I'm watching you from Nairobi. You understand. You see that, and it's good that I know even in my own country, there are some people who are still following and watching. Yes. So we have said cardiomyopathies are a group of diseases that affect the heart. These conditions they destroy the heart, the capability of the heart pumping blood. The work of the heart is not giving you emotions. Don't say when you are heartbroken that you are heartbreaking me, my heart will fail. Hey, heartbreak. Do you think we should add heartbreaks in the complications of the heart? Those that are heartbroken, should we say that we add them on the complications of the heart? No, there are several things that cardiomyopathies do. There are several things that cardiomyopathies do. Destroy the capability of heart pumping blood effectively and may interfere with the electrical system, leading to abnormal heart rhythms. We call them arrhythmias, abnormal heart rhythms. So those are cardiomyopathies, diseases of the heart. Diseases that affect how the heart is beating, not diseases that give you the social emotional heartbreak. No. Social emotional heartbreaks, and then you say, you have destroyed me, heart. You have destroyed me. I cannot feel even anyone else because I loved you so much. No, we are not talking about that. Here we're talking about the physical heart. This one. This heart that you have, this heart that pumps blood. You understand me? You check that out. So as we talk, Don't say I have a heartbreak. Don't tell us you have a heartbreak. Tell us that I'm feeling like this, like that. My heart is pumping. I can feel it. I can feel palpitations. I can, heart failures, arrhythmias, stroke, sudden cardiac death. Hey, I don't like saying that name. Sudden cardiac death. No. And I don't want to add their emotional heartbreak. No, this is the physical heart. The physical heart that pumps. And then blood circulates through your body. You see, then blood circulates through your body, circulates even to your brain because the heart is pumping. And we have been talking about the heart for so long. The heart and the brain, the major components of your body, the liver and the kidneys, not exemptional. They are very important. So these are called end organs where blood should reach and they should help you sustain life. The heart helps you to sustain life. So heart failure, if you have cardiomyopathies, is imminent. Arrhythmias, abnormal heart rhythms, it can be tachycardia, it can be fibrillations, it can be bradycardia. So tachycardia is when the heart is beating faster. Bradycardia, slowly. Fibrillations. Fibrillations. If I gave an example of this. Now, you have low blood pressure. Let's get low blood pressure. Even you are getting weak because oxygen is reaching the brain so slowly. Normally. That is normal. Oxygen efficiently is getting to the brain, but there is this one, high blood pressure. After some time, you get stroke, but there is another one which is an emergency, fibrillation. If your heart is beating like no, there is no blood that is being pumped. That is an emergency. You need to get some shocks or amiodarone injection so that it can slow down. You see? Yes, blessings to Benjamin the Wise Guy, everyone in the chat. I'm getting something to eat right now to start another job outside right now. Oh, nice. Uncle, you have made me now to start doing what you are doing. You see, today I had to get some time to go and do. And I think Uncle is inspiring me to be doing some things by my own. But I like that. So if you have cardiomyopathies, if you have these cardiomyopathies, what can happen? You can have heart failure. You can have arrhythmias. Heart failure is ability of your heart pumping blood effectively. Ability of your heart not failing. I know you have seen that video when the scorching sun was heated up, and I was working with my boys there. You see, I hope you'll watch it. Now, heart failure is not that the heart has stopped. No, heart failure is the ability of your heart pumping blood effectively. Arrhythmias, I've talked about them and I've demonstrated. Those are arrhythmias. Stroke. The blood has not got into the brain, so part of your brain has died. And because, when there is no oxygen and nutrients, body cells die. Sudden cardiac death, and then you are taken to theater. We are putting you in a machine as we try to find some heart for you, maybe a pig or someone who donated. You see, cardiomyopathies, a group of heart diseases. And today, what am I doing? I'm just giving an insight. I'm just giving an overview of cardiomyopathies, the group of diseases, because they are called group of diseases that affect the heart muscle. There are several. My friend, if you're coming in, you are my friend. Don't just come in and go. Don't come in and go. You wait for me. Say hi. Say hi, Dr. Ben. Hi, where are you watching me from? Tell me where you're watching from. Let's interact, man. Shake my hand, and chat. Come to the chat and tell me where you're watching from. Don't just keep silent. If Jamaican Miriam, you are always funny. Jamaican uncle, we are talking about heartbreak. No, we are talking about physical problems that affect the heart muscle. You. I think I think this topic of heartbreak should be included into cardiomyopathies. It can be included in problems that the heart face, because the left side is a heart. The left side is a heart, and then when you are heartbroken, you always say, "Don't heartbreak me." Don't heartbreak me, because if you heartbreak me, I will. No, there are groups of diseases that are let me answer. Coffee cakes are live, but I can't see myself. We cannot add heartbreaks in the groups of cardiomyopathies. No, we cannot. Let me see. There is a package that has come here. Uncle, this thing has come from your place, the US, and it just arrived right now. I don't know how to open it. Oh, open. Let me open. I see what they. Oh, okay. This. They are. These are called. Oh, these are called 1, 2, 1, 2, 3. 1, 2, 3. These are called what? These ones are called. These ones are called oxygen sensors. They are for the car. They are from the United States. Yeah. Oh, nice. So, welcome. Sorry, I was putting some food together. No worries, Jamaican uncle. I'm watching this that have been shifted from your place. That are shifted from your place. Oh, there is another one here. Okay, nice. There are 4. This one, there are 4. Hi, Jamaican uncle. Coffee cakes, how are you doing? Today I've been up and down here and there. Up and down here and there, around and about. So we are talking about we are talking about supposed to put them here. These people are so effective. I ordered this 2 days ago and they are here. 2 days. Imagine from the US. Someone must fix my heart. What? Someone must fix your heart. Someone have to fix Miriam's heart. Let me put these ones aside, and we what are these? Oh, nice one. Someone has to fix Miriam's heart. Also, Miriam, we thank you for coming out straight. So, what is that? These are called oxygen sensors, not for a person. Yes, coming. Yes. Get a minute to irudisha chini. Guys, a minute I come. Let me come. This one is kind of like an emergency. Yes, complicates. Hello, I'm here. Now, Miriam was saying we are dealing with matters concerning the heart. And we have said cardiomyopathies are groups of diseases. There are groups of diseases that affect the heart muscles. These groups of diseases that affect the heart muscles are very specific. And heart failure, arrhythmia, stroke, sudden cardiac death, all those affect the heart muscles. Classification of cardiomyopathies, they are classified. So let me take this moment and welcome my friends. Yes, coffee cakes. Coffee cakes. Let's welcome coffee cakes and everyone. So we are talking, guys. We are talking about cardiomyopathies, groups of heart diseases. That affect the heart muscles. So coffee cakes, Miriam, Jamaican uncle, Sandra, all of you that you are watching me. If you are watching me and you are in Kenya, please tell us we are in Nairobi or where you are chilling from. If you are watching me and you are in the United States, you are those places, tell us where you are watching from. Don't just be in class and no question. Ask a question. Say what you feel about the topic. Tell us if you are not feeling it or if you are feeling it. Yes. So Miriam has told us that we should add heartbreaks as one of cardiomyopathies, diseases that affect the heart. We should add heartbreaks. Hey. I like it. I like that because the sign of love is a heart. Miriam, you like that? I think we will add that. So welcome, my friends. Welcome Today we have been having several short sessions. It has been a day of ups and downs, you understand. Now, there are several diseases that affect your heart. And I will name them, but we will learn. Today I'm just giving an overview. Of these diseases. Like, let's say, dilated cardiomyopathy. So, dilated cardiomyopathy means dilation, being big. Hypertrophic cardiomyopathy. You hear those words? I'll explain them one by one. And we have another one called arrhythmogenic right ventricular cardiomyopathy. This one concerns the rhythm, how the heart beats. Unclassified cardiomyopathy, you cannot classify. Unclassified, yes. Takotsubo cardiomyopathy, left ventricular non-compaction cardiomyopathy. All this we will learn about them. And many people out here are walking around with these problems of the heart without even knowing. You are walking around with the diseases of the heart without even knowing. You see, there is several things that we need to understand when it comes to diseases of the heart. Lifestyle and congenital anomalies. When you were born, you were born with these problems. Most of them also are acquired. Now, you, as we talk about these things, relate them to the problems that you've been facing and the problem that you've been seeing daily in life. You see? So, my guys, my people, my brethren, everyone that is here looking at me, have you shared this? Have you shared this to your friend? To your friend. As your friend knows that there is a Benjamin the Wise Guy or Dr. Ben somewhere that watches and feels your vibe every time. So, dilated cardiomyopathy is characterized by enlargement of both ventricles. So, if these ventricles enlarge, they will not push blood as needed. The ventricles become enlarged, and the space that blood should fill is less. That's why we call dilation. And these ones are caused by we have symptoms of this problem. Fatigue. I'm just giving an overview. If you have a question, please ask. Please ask if you have a question. And then at last we will go to the problem of Miriam, the one that Miriam told us we should discuss. Which problem is that? The problem of Miriam is the heartbreak, the heart breaking up emotionally. The heart breaking up emotionally. Hey, my friends, that is a very funny dimensional query. So, my friends that are here, who is still here? If you are still here, say hi. Let's interact. If you are still here, say hi, Dr. Ben. We are watching you and feeling your vibe. Today I've come live like 3 times. Like 3 times. I don't know if I was just feeling like talking to my friends, and you saw even I came live with showing my facility's name. It's under my name, the Benham Medical Center, with the heart. Heart, the heart like a lion. Yeah. So my friends that are watching, if you're here, say hi. If you're here, say hi. So dilated cardiomyopathy, that one we will learn about it very soon, and we will learn it in depth. Don't worry yourself. These things come automatically. When you feel fatigue, dyspnea, orthopnic is like you are swallowing air. Paroxysmal nocturnal dyspnea, and sometimes your legs swell. We will know why when you have heart conditions, your legs swell. Palpitations and syncope. I know most of the people, what they usually know when there is a problem in the heart is palpitations. Palpitations is a sign that everyone knows when they have a problem in the heart. Palpitation and lack of breath, feeling like you are not breathing, palpitations and lack of breath. You see, these are things that we should learn and we revisit as we come again and relax and think about them. You see, so let's think about something that is called the signs. What can show you that you have this problem of dilated cardiomyopathy. I'd say today we are just jumping. Today we are jumping as we are bringing this around. Jumping as we are bringing this around. As we are getting to know diseases of the heart. Plus the other one that Miriam told us. Miriam has told us about one that is very fun. The one that is very funny is called heartbreak. Miriam has told me, we should introduce heartbreak. We should introduce heartbreak as one of the diseases that affect the heart. And we should have a way of fixing it physically, not emotionally, physically. Miriam, very funny. You are very funny, Miriam. Miriam, you are very funny. Now, signs, displaced apex beat. When you have dilated cardiomyopathy, this one, the heart swelling, the apex beat is always here on the left side here. When you touch here, you feel the heart popping. Boo, 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 boo. But you'll see it has gone to around here sometimes. Blessings everyone here to support and learn. Burnout to be blessed. Good, and thanks for you coming in and supporting. We have seen God is blessing you and you are doing so good. Burnout to be blessed is coming out so vibrant and so cool, So guys, if you are watching and you have not visited Burnout to be blessed, so I've said one of the signs is displaced apex beat. The apex of the heart. I'm showing you it like you are seeing. This is the apex of the heart. This place of the heart is called the apex. This place is called the apex. So this place is always around. Let me sit straight now. This place is always around this on your left. This is my left. So here, so if you take a stethoscope, even not a stethoscope, if you take your hand and place it here, you will hear it pumping, boo, 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 So that is the apex beat. But when you have this problem, it will not feel here, you will feel it around somewhere here, or it will be displaced upper. It depends with the dilation. So S3 gallop, sometimes the beat of the heart shifts. Function mitral regurgitation. Mitral regurgitation. Mitral aortic valve, mitral valves, tricuspid, pulmonary. So the mitral, sometimes you feel like the blood is coming back. I'm not hearing you. Anyone who is hearing me? Are you hearing me now? Uncle says he's not hearing me. Anyone who is not hearing me, let me get. Are you hearing me now? Uncle, I think your voice, you should restart your phone, because my functionality here states that it's doing well. Let me check. If someone is not hearing, is anyone hearing me, please? Anyone who is hearing? Let me check my functionality. This is a lesson. If I'm not being heard, it will be harder. If you are not hearing me, are you hearing me now, Jamaican uncle? Am I loud and clear right now? Okay, let me check. This page isn't working. What is happening? Let me check. Okay. Anyone hearing me now? If you are hearing me now, please confirm. Please confirm. What's happening? What is happening? Let me check. Okay. Let me check if it is functioning. If anyone is getting me, please tell me. Let me check. Okay, so it seems that uncles I think uncles uncle, you have to restart your device. Someone to tell Jamaican uncle to restart his device. Someone to tell Jamaican uncle to restart his device. Yes. Yes. It could be your device. Boo! Restart uncle. Good. Now we continue with Benjamin the wise guy in the house. Benjamin the wise guy. I don't like people not listening. Uncle, please restart the device, please. So if you are watching and you're coming in now, please hit the like. So I'm going to turn it off and on again. Yes. At Jamaican uncle, do that. Yes. Okay, now if you are coming in right now, we are talking of other diseases that affect the heart. And Miriam, you were good before, and Miriam has told us to add heartbreak as a group of diseases that affect the heart. Where is Miriam? Miriam, where have you gone to? Where have you gone to? As you tell us, we add heartbreak to those diseases. Where is Miriam? Where is Miriam? So, my guys, let's continue. So, pulmonary clackles. When you hear the heart with the stethoscope, where is my stethoscope? They have come in late. You understand what a stethoscope is? That thing that we put here, and then we listen to heart sound. We listen to heart sound that are doing. So you will hear crackles like. Those are signs that your heart. Sometimes, let me tell you, my friends, when you hear the chest crackling and wheezing, sometimes it may not be coming from the chest. It may be coming from your heart. So don't confuse when your breathing sounds that always come from the lungs. No, they come from other places, even the heart. So this is where we do x-rays. We will start learning about these things one by one. Uncle is restarting his phone. Who is new here? Who is watching and has not commented? Today we are just talking about randomly groups of diseases that affect the heart. My friend, if you are here, please tell us where you're watching from, my friends. My friends, tell us where you're watching from, and watch other videos. Watch other videos. You will learn a lot about your body and health. You will learn a lot about your body and health. So, my friends, here is some of the things that we talk about. Treatments. We will talk about treatment in dilated cardiomyopathy. Dilation is when the heart muscles are bigger. The heart muscles, when these heart muscles are dilated, they are big. That is a disease. When these heart muscles are bigger than expected, that is a disease. Hypertrophic cardiomyopathy is the second one that we will talk about. It is an inherited disease genetically, characterized by abnormal thickening of the myocardium, especially interventricular septum. This is what we call the septum. This one, intraventricular septum, without another cause as long-lasting hypertension or aortic stenosis. So these ones have several questions. They are genetic. These are genetic causes. When you have genetics disorders, these are genetic causes. So you will learn about what causes these heart muscles to be thick, what causes these heart muscles to be, step by step. We cannot do everything in one day. Big up everyone who is watching, man. You are everything, because I'm good now and I'll be in the background. Blessings to each other and everyone. So if you are watching and it's your first time, tell us where you're watching from. Tell us where you are watching from. Don't just, I usually say, don't just watch. Acknowledge the chat. Acknowledge the chat. Come to the chat and tell them, I'm watching you are live from this and this state. We are watching you from here, and we love what you're doing. We love what you are doing. So let's talk about that was hypertrophic, when the heart muscles are dilated. And we have this one. The first one was dilated cardiomyopathy. Dilated cardiomyopathy is characterized by enlargement of one or both ventricles, the ventricles enlarging bigger, and this one, the other one, is thickening. There is a difference between thickening and enlargement. So these are things that we should be looking at and following when we are talking about these problems that we are discussing. Now let's talk about the third one. The third one is called restrictive. Imagine from dilated becoming big, thickening, and now it is restricting blood. It is characterized by stiff ventricular walls, causing impaired feeling during the systole. Stiff. They are very stiff. Even they cannot relax, and you are born with a heart that is stiff, that cannot relax and constrict. It is called restrictive. We will learn about these causes. What causes the problem? If you are here watching and you have a question, don't fail to ask. Who has a question? Who is having a question? Or I'm just talking. You may fail to understand what Doc is doing. So if you have a question, ask a question. Ask Doc, Dr. Ben. What are you talking about, Dr. Ben? What are these diseases that you have, heart diseases that you are talking about every time? And then I'll explain. But as I continue, Miriam, our friend here in the chat, has told us we should add heartbreaks to the group of diseases that affect the heart. I have to put that as a poll. Let me put that as a poll and ask people, should we add heartbreaks? Miriam says we add heartbreak. Heartbreak. Heartbreaks. The heart has breaks. So when you have heartbreaks and the heart, why is this heartbreak? Should we add heartbreaks as a group of diseases that destroys your heart? Group of diseases that destroy your heart. That is a poll. Your heart. Should we add heartbreak as a group of diseases that destroy? Miriam says we add heartbreak as a group of diseases that destroy your heart. Should we? Let me say, should we? Should we? That is a poll. Yes or no? The polls nowadays are yes or no. So we add here. Yes or no? The poll has started. So you vote yes or no. Let's see how the poll will go. Let's see how the poll will go. Now, my people, my friends, my guys, my friends. Now we are talking about those groups of heart diseases. The other one that we were talking about, heart attack, that is something else. But heart attack, which is called myocardial infarction, that is one thing. And this one that we want to talk about is another thing. This one that we are talking about is another thing. So this one, heart attack, we said the muscles just losing. Cute Jessie is here, my friends, and Cute Jessie says you go and play a playlist. Cute Jessie told me that, please, big brother from Dr. Ben, remember to hit my playlist. So I'm not the only one. You who is watching, please visit Cute Jessie and don't forget, she has a playlist. Run the playlist. Let her get the hours and let her get monetization. We'll be helping someone. Cute Jessie, welcome. Now we are continuing. Miriam, I've put it as a poll. You are the one who said it is. We are talking about heartbreaks now. Let's see what people will say about your poll. Your poll. Now we were continuing. Dilated, hypertrophic, dilation. We are talking about Miriam. Yes, you are the one who said, Miriam, we put heartbreaks as what? We put heartbreaks as diseases that destroy the heart. But now, whatever we are talking about is very different. We are talking about dilated hypertrophic cardiomyopathy, a disease that dilates the heart muscles. Hypertrophic, the one that thickens the heart muscles. Restrictive, the one that makes blood not to go well. So restrictive cardiomyopathy is characterized by stiff ventricular walls. These walls become very stiff and they cannot relax, and they become very stiff. They cannot relax and dilate. So that is called restrictive cardiomyopathy. And then we have another one that is called, we will learn one by one. So before we reach to Miriam Mumbua's one, we will have learned a lot. Arrhythmogenic right ventricular cardiomyopathy. It's an inherited from genetics which affects the right ventricle, affects the right ventricle muscles. Is progressively, instead of having the normal muscles, instead of having a normal heart muscles, you are having heart muscles like You know, when you have cut yourself somewhere and then it is healing. I don't know if I have any cut somewhere. And then it is healing. It leaves a scar. So you have heart muscles that are like those ones. Scars in the right side. And fatty tissues. You know, a muscle should not have fats. Lean muscle should not have fats, so that you can do what? You can relax and contract well. You see. So let's talk about something that is called no, let me not go there. We will discuss as we discuss one by one as people learn. So we have said we are talking overview. This is an overview of diseases that affect the heart muscles. Cardiomyopathy, cardio, the heart. Myopathy, diseases. Myopathy is diseases. Diseases, physical diseases, not emotional diseases. Not emotional diseases. Physical diseases that affect the heart muscle. You know, physical diseases that affect the heart muscle. Let's talk about something that is called Takotsubo. Takotsubo. Takotsubo is also called broken heart syndrome. Cardiomyopathy is a transient weakening of the left ventricle, often triggered by several emotional or physical stress. Now we have started talking like Miriam. Miriam, now we have reached where you are, because the fifth one, which is called Takotsubo, it is stress related. Stress related, imagine cardiomyopathy is a transient weakening of the left ventricle. This left ventricle. Because why is it related to the left ventricle weakening? Often triggered by severe emotional or physical stress. Heartbreaks now. Now, Miriam, you are crying for adding this to you are crying for adding heartbreaks to cardiomyopathies has been approved. Because this is called a stress-related heart problem. When you are heartbroken, you have stress. You know, sometimes you can have a breakup and you don't have stress. There are some people when you leave them, you feel better. Takotsubo stress. Let me post it. It is called Takotsubo stress cardiomyopathy. You know, it depends. Heartbreaks depends with how much you love the person. But when you have loving people that are loving, people that are loving, they will not feel something. They will leave you, and tomorrow they are very happy somewhere. And you are having you are having problems. You know. So this one is stress related. Stress, being heartbroken does not mean you will be stressed up. Separating from a person you love, because some people separate and that is what they were waiting. And that is what they were waiting. You know, sometimes you can wait for the day that you want to separate with someone for so long. That day but when this person tells you now that it is over, you feel so nice. So that is not heartbreak. Heartbreak is where you love, you emotionally and physically invest on that relationship, and you are told it was never enough for us. You will get a heartbreak. So Takotsubo is a stress-related heart problem. For those that are listening and coming in, for those that are here listening and coming in, that is now stress-related. You can have stress until it is affecting your left side of the heart. Your left side of the heart. Physical stress or emotional stress. Major surgery, severe illness, not related even to to heart problem, but you've been having a problem like severe malaria, you've been having a problem like diabetes, ketoacidosis, you are in the ICU, you have been having a problem like which ones? Those acute problems, bacterial meningitis, and then you are in the hospital. You can start having left ventricular heart problem. Apart from emotional problems, this is now called Takotsubo. And that's why when some people get issues, they do what? When some people get issues, what they do is, you can find someone getting stroke, and this person was so healthy. Depression. A person is admitted with stroke. A person is admitted with stroke, and this person had never had high blood pressure. Now you know why? Heart complication, which is called Takotsubo. Yes. So if you have a Takotsubo in your life, if you are having problems when it comes to heart diseases, heart conditions, and another person is not having any heart condition, and you are there, you get a stroke, and then people start to say that, and this person did not have any health crisis, mostly even the heart. You start blaming a doctor for bad diagnosis. You should know there are deeper things that we know, like Takotsubo. I know this is the first day you know that stress can give you a problem in your heart. Stress can give you a problem in your heart. I know this is the first time you know now. It can give you this problem that is called Takotsubo, cardiomyopathy. Yes? Emotional stress and physical stress. You can start seeing chest pains, arteries problems, those issues that are coming in, you start having some problems, So for all of these problems, because today I'm doing 1 hour, unless anyone has a question, I have some few minutes to go. To all of these problems, we do we check history, genetic. We give you an ECG profiling. We do an electrocardiogram. Electrocardiogram is the one that gives us those lines. Someone told me, what are those lines for? It is telling us how your heartbeat is, how your heart is contracting and relaxing. Echocardiography, first line imaging, echocardiography. Those things help us. Blood tests, troponins, thyroid function, we study them to check if you have a problem that is giving you a heart problem. Genetic testing when inherited disease is suspected, because like Takotsubo and the other one that we learned that is called, this one is called arrhythmogenic right ventricular cardiomyopathy. That one is inherited. If someone in your family had this problem, maybe you may inherit the problem. So we do genetic typing, we check, we see if you may be carrying the problem with you. Holter monitorings, all those genetic testing when inherited disease is suspected is important. Endomyocardial biopsy. We take sample in your heart, we do something that is called biopsy to check if there is a problem with your cells. And when you have these problems, there are you can get heart failure, ventricular tachycardia, atrial fibrillation. Fibrillation is when your heart is beating faster than normal. It is called atrial fibrillation. Mitral regurgitation, cardiogenic shock, sudden cardiac death. Let's not talk about deaths here. Now, there's some ways you can prevent them. You can prevent them by checking your blood pressure daily, taking your diabetes medicine as required, and checking your cholesterol levels. Now that you know, we have cholesterol. There are some people that have genetically in their line, they have problems with producing high cholesterol levels. We will learn about that. If you want us to learn about it, we will learn about it very soon. Hypercholesterolemia. Hypercholesterolemia. People that have problems on producing cholesterol levels at a high level. So those are very important facts in life. Very important facts in life that we should wait a minute. Okay, that we should be checking on, and they are very important. So taking prescribed medications every time you understand is very important. Attending your cardiac clinic if you are suspected to be having heart condition, it is very important. So what I want you to understand this week, what we will be doing is 1, 2, 3, 4, 5 things. Other diseases that affect the heart. Even when blood is being pumped in the heart, even when the heart is being pumped in the heart as required, you still have these problems. And I will name them because it is important to name these issues. It is important to name these issues. Dilated cardiomyopathy, enlarged weak heart. It is only saying enlarged weak heart. Your heart is enlarged and it is weak, you see. And then we have something that is called hypertrophic cardiomyopathy. Your heart is thick, heart with impaired relaxation. Thick heart with impaired relaxation. If you have a question, please put it down. Let's discuss. I hope someone is listening and getting it a bit, right? A bit. You know, sometimes when you introduce a topic, some people may feel that this topic is complicated. This topic about the heart disease is very complicated. So I'm just talking about other diseases that affect the heart, other diseases, hypertrophic, thickened heart, dilated, a heart that the muscles are, you just relate, dilated heart muscles, thick heart muscles, hypertrophic heart muscles, thickened heart muscles, you see, thickened heart muscles, you see, very funny. And there is something that is called, the one that we have discussed, that is called restrictive cardiomyopathy. The ventricles themselves, they are restricting blood to come in, so you are pumping out less blood. You are pumping out less blood. So that is called restrictive cardiomyopathy, pumping out less blood. Now let's talk about something else. Something else that we want to talk about is, we want to talk about something that is very important. And what is this important thing that we want to talk about? We will talk about ARVC. ARVC. Fat. Your right ventricle is filled with fats. It is making your heart not to pump blood now. So it is giving us rhythms that are not normal because of fibrous tissues and fatty layers. You know, when you have fibrous tissues and fatty layers, you have a problem. Stiff ventricles causing impaired feelings, diastolic dysfunctions. You are having bad rhythms. And then we went to the last one, which is called Takotsubo cardiomyopathy, where Miriam says that is where. So anyone who has a question? Now, yes, we have talked about them, and someone will ask, why should we learn about this? on YouTube, open channel, that we are giving this knowledge openly to people. Why? Why should we have this as an open forum? Heart complications. We know heart complications are very specific and they are very complicated. Raise public awareness. Raising public awareness. Help detect disease early. You know, when you are having awareness of these problems that I'm talking about, you may save more money and you may save a life. Because when the complication is too much, helping it becomes a problem. When the complication is too much, helping becomes a problem. So we just raise public awareness about what we are talking about. Help detect diseases early. Help detect diseases early. We detect diseases earlier so that we can prevent complications of the heart. You know, prevent sudden cardiac death. When you are aware of the symptoms, you will help yourself. We are listening. Yes, thanks Miriam. When you are aware of complications, certain cardiomyopathies and hypertrophic cardiomyopathy, you know, educating everyone about warning signs and importance of screening can help identify the risk and the risk factors that come with these diseases. So we just don't learn. You know, we are helping to detect diseases early, and also we are raising public awareness. Many people know about heart attacks but don't know cardiomyopathy. You know, when we were talking about heart attack, everyone was coming in saying whatever he has, saying whatever she has about heart diseases. But you didn't know there are other group of diseases that are called cardiomyopathies. You see, so you may say you are having a problem. You will always say, I'm having problems with my heart. I'm having problems when it comes to my heart. But when I'm going to do the ECG, it is normal. You have never done an EKG and a chest X-ray, so you will never see dilated vessels. You see, so when you have awareness, you help people not to have these problems. You know, you prevent sudden cardiac death. We don't want deaths. Correct common misconception. We are talking these things open. So every person says that every heart problem is caused by blocked arteries. You see, every heart problem is caused by blocked arteries. Not every heart problem is caused by blocked arteries. No. Now today you know there are other heart problems that are called cardiomyopathies that are not blocked arteries. No, heart attack can be caused by blocked arteries, but cardiomyopathy, no. So you see, those are misconceptions. Chest pain is always present in heart disease. Misconception. There are some heart diseases that don't cause chest pain, but they cause some other symptoms, as we may learn. You know, and some person will tell you that, you know, you are having a heart condition. You are starting to age. You are old. Why are you getting heart condition? Only older adults can get heart condition. Even young adults can get heart condition. Mostly those that are inherited. A video can explain cardiomyopathies often have different causes, condition, and I'll bring a video. You watch on how the blood, the arteries are okay, but you're having cardiomyopathies. There are some symptoms that people ignore, like headaches. Sometimes you say you have worked so hard through the day, so you are feeling dizzy or fainting. Those are problems that we should learn. Palpitations, heart beating, persistent fatigue, swollen legs, and breathlessness. These are things that some people ignore. Understand these symptoms may encourage early management, early medical management. When you understand these symptoms, it may give you early medical management. So these are things that you should not ignore. There are some symptoms that people ignore because you have been working through the day and the scorching sun is hot, scorching, and then you feel that because the season is sunny or cold, that's why I'm feeling headaches. No. But when we understand and you don't ignore these symptoms, you save life. You see, and there are some questions that we may learn here. There are some questions that even we learn, like to educate families and patients if the disease can be cured or is it just manageable? Is it hereditary or it is not? Will it need lifelong medication or not? Those are things that we discuss here. Like someone asking me, should I take hypertensive drugs forever? Those are the questions that we usually learn and talk about. There are some diseases that they require management, and there are some diseases that they require curing. Curable diseases and managed diseases. Those are things that at the end of this topic of heart diseases, we need to understand and do what? And know about heart conditions. So as we learn, don't forget to ask those questions. I may forget to give you the concept, but you asking a question may give me a concept. Let's talk about the other thing. Promote healthy lifestyle. That's what we usually talk about. Enrich students and health professionals also. And sometimes when I'm discussing, it makes my clients have the trust and credibility. They know that this is not just a joker. This is a person who went to school and learned medicine. And the way he discusses medicine and we understand, it seems that this doctor knows what he's doing. That's why sometimes when you try to challenge a doctor and the doctor is not ready to tell you, this one I'm not sure about, that doctor becomes hard or just avoids you. The doctor becomes so hard. Sometimes some people become so rude. Yeah? I've written that for you. Go and get the medication. Stop asking so many questions. If you have forgotten or you don't know, just say, for that one I'm not sure. Don't be rude, So for coming online, discussing, you interacting about these topics, it is helping even me to refresh and also to be trusted on what I'm producing, because you have seen several times when I'm here. You have seen several times when I'm here and my fellow docs come and say, Doc, you are doing a good job. Those are my classmates. If I go wrong, they will say, no, Doc, I think here you are not doing it correctly. You see, you are not doing this correctly. So those are things that makes us come online and discuss and try to make everyone understand the questions and the things that we talk about. So it's been 1 hour, but today I've come online several times. And thanks for everyone that has been coming and watching. You have seen today I even did watering, gardening, and right now I've come in my office. I'm treating patients, and I'm with you now. We are interacting, and congratulations, for Miriam. Your quest for putting heart brakes on cardiomyopathy is here. Emotional distress can cause takosubo. Takosubo, which is a problem of the heart. Yeah. So anyone with any question today, anyone with any question, my friends, I've said everyone who is watching, Cute Jassy and Miriam Mumbo are requesting you to do their playlist. Yeah, are requesting you to do their playlist. So if you are watching and you're here, don't forget to visit their channel. Don't forget to visit their channel. They are good ladies we have here, and you can watch what they are doing and react and say something, encouragement, encourage them. So my friends, anyone with any question, let's get some 2-3 questions before I leave, before I drop down, before I go down to the bushes. Anyone with any question, my friends, at least 1 or 2. Let's just not go like that. Oh, it's 6:30. I can see it is 6:30 p.m. here in Kenya. Kenyan time, 6:30 p.m. 6:30 p.m. 6:30 p.m. So guys, what are you feeling? How about which other topics should we discuss? Which other question do we discuss? Which other topics do you think are important to discuss on this channel? Yeah, we eat all the books. We ate all the books. Kula vitabu. Miriam is translating Sheng the direct way. In Sheng, there is another Kiswahili language as another language out of it called Sheng. And so, 8 books means you did it. You went to school to study so hard, So she's saying, ate all the books. I ate all the books. So if you have any topic that you need us to talk about, don't fail to interact and don't fail to interact and let's communicate. For everyone who is here, thanks for watching, man. Always share my videos. Everyone needs growth, even me. Cute Jessie here says, play my playlist. You are not playing her playlist. Why? And she's just requesting. Play those playlists. Let them have hours. Miriam Mumba needs your support. Go to her channel. Super chat them. Play the playlist. Make them feel good. Make them feel as empresses. You see. Support someone. Support Jamaican uncle. Jamaican uncle is always here supporting everyone. Even calling out for people, specific people, telling them, please go and visit so and so. So and so is online. Please let's go and support him or her. And you're just there not supporting. Why? Why? I've noticed some people will avoid some channels when they see there are problems. But don't fail to support my sisters. Nowadays people don't need a lot of drama, a lot of problems. They avoid when they see a problem. But me, I'm saying, these are my sisters. Support my sisters, man. You will watch, you who are watching, if you have not subscribed to them, go and subscribe to them. Growth is imminent. Some people do they do certain jobs because their YouTube channel is not paying enough. But if they are paid enough, Cam is telling me low battery. Let me put it on power. Let me put it on power. Me, I need power. There is a certain politician in Kenya who said, "We want power." Old politician. We want power. What is power? Now, I was talking about these things. YouTube can be a source of employment, and it has employed so many people. When your chest is heavy, it means you are having a problem. It means it might be a problem from heart muscles that are not pumping well, or blocked coronary arteries. It may be, but it may also mean that you are not getting enough oxygen. Pneumonia can make you have a tight chest. Pneumonia can make you have a tight chest. So, my guys, I was saying YouTube can be a source of employment, and it has employed so many youths who are doing it full time. Not us that we do it part time sometimes, like right now that I'm not very busy. Today I was not very busy. You have seen me jumping up and down today. You see. So when some people are asking for your support, whatever they are asking mostly is, go to their channel, advise them, let them get the right advice from several advices that you leave in their channel. Tell them this to your channel, and don't do this and this to your channel. Don't chase that person away, because it means that 1 or 2 people, or 20 or 30 or 40 or 50 or even 1,000 people are thinking like that person, or even 20,000 people are thinking like that person, and they like you, but you are not doing what they want. They want you to do, and YouTube is a game of numbers. When you have a lot of people, you get more likes and you get more views. So listen to the people that come to your channel. Listen to them and get the right advice. As long as they are advising with positivity, not negativity, get it, introduce that to your channel. I've had some people saying that I cannot watch a faceless channel, it's boring. Yes, listen to those channels. Some people like watching them. Some people like watching rivers just that are flowing. Some people just, because it refreshes them. Some people just like watching thunderstorms and hailstones in a video. Some people just like watching flowers silently. Listen to the people that come to your channel. Don't chase them away. Get the inspiration from your channel. And when there is this thing that happens, you can do one video and a lot of people follow you, watch it. Kind like find the unique feature in that video that you did that is making a lot of people to come and watch you. Do it. Repeat, use that feature that you used to make people to come to your YouTube channel. You see? And don't copy someone else. Don't copy someone else. Do you. Do whatever that you're supposed to be doing. Do yourself. Don't travel like the other person. Don't copy how the other person is doing. Do your thing as you. Do your thing as you. See. So we have learned a lot of things today. Cardiomyopathy, at least right now, besides heart attack, you understand there are some problems that the heart undergoes that is not heart attack, and we will learn these things slowly by slowly. Here I talk about, and you have noticed one thing, most of the things that are not medical After I have done them, I release them to members only, because this channel is a medical channel. If you don't want to check and see extra, what you can do is you can go to members only and check on what on the videos there. That's why some people are asking me, what doc, why are you putting some videos on members only? I tell them, because this is a medical, it's okay, no problem, cute Jassy. I am putting on members only because this is a medical channel, and extra things that are supposed to be seen, let them be on members only, because now if someone comes and see some videos are not for members only, will be confused. That person will be confused. So 5 minutes to go, and then I close up my session, unless anyone else has another question that is a burning question. Anyone who has a burning question, you can ask as we continue. But we have started cardiomyopathy. From tomorrow, we will be learning how these cardiomyopathies are affecting someone's body. So don't worry yourself about these issues. But for support, I've told you, for those that are struggling with hours and views, you guys support them. You guys support these people. Let the flow go on as needed. So I think we should. There is no any. I'm here too, Dr. Benjamin, but a bit busy listening to the background. Oh, Johnny, be good. You have been here. Some people are so good, like Johnny Be Good. Johnny Be Good is a nice guy. Some people don't have some YouTube channel, Some people don't have YouTube channels, but they still support. Come online from abroad and they support you. And you feel nice. And you feel so nice, But let's continue with I'm waiting for any question before I go out. I'm waiting any medical question. It's not a must to be heart complication. Any medical question for anyone. Any medical question is welcomed here. Any medical question is welcomed. Any medical question before I go out. Any medical question you can hit. You can hit up. Sometimes it's not good just to go, and people are still thinking of questions that they can ask, and you are there to help. It's good to wait. And Betty is here. My wife's namesake is here. Betty, today we have been learning about cardiomyopathies, and we have just introduced other diseases apart from heart attack. And I see people didn't know there are some other diseases of the heart. We had other heart diseases, but you can rewatch and check on. This. I have some. 2 minutes. Dr. Benjamin, we Jamaican are a little stubborn when it comes to healthcare. We usually use home remedies forever. Uncle told me when we were with Jamaican uncle told me that. He told me that, in Jamaica, many people don't go to hospitals. they can't like use home remedies every time. Every time they can't like use home remedies. But you see, if they are working, it's okay. But don't use home remedies in everything, and then you find that you have even problems that are worse that are coming out of the home remedies. But you see, another thing is, Johnny Be Good. There is this part of medicine that Johnny Be Good says we are all doctors. You are talking to me, brother. Imagine I'm multitasking, so a lot of is passing me. No worries. There is that part of medicine that is called. This part of medicine that is called complementary. We have talked about it, where you go to hospital, but you are still using the other method that is called herbal medicine. So complementary medicine is the taking herbal medicine plus the hospital medicine, and then you blend, and then everything becomes better. You see, so don't worry yourself. It is okay. It is very okay. It is very okay. So that is it, my friends. What is it, my friends? So nice one, Johnny Be Good. Nice one. So as we talk, and Johnny Be Good, be telling me, for this problem we are using this one. We do this so that I can relate. But next year, if you will be in Jamaica, hey, I'll be there. Next year I'll tell you the date. Some guys have told me, tell us the date so that when we'll be visiting Jamaica, we all will be there. That's why I mostly interact with you when you are playing good music. Big up, Johnny Be Good. On Fridays, that is on Fridays. Feel Good Fridays. Feel Good Friday. When you are doing some Kokoti, when you are doing some Beres Hammond, when you are doing Marcia Griffith, when you are doing some John Holt, I met this girl on a rainy day. Things like those ones. Johnny Be Good, the best medicine in the world that I know. The best medicine in the world that I know is music. Music is the best medicine. I'm still in love with you, boy. You see, it makes you feel good. It makes you feel loved. It makes you feel rejuvenated. You see, Capleton. Who knows Capleton? If you are here and you know Capleton, tell me. The one that sang, that day will come, Judgment Day. Joshua clean out the bad deeds, and separate them from the good, cause the day of a harvesting day. Whoa, boy, Joshua clean all the bad weeds, Harvest time, one stone. Rastaman throw one stone, and it brings about a feeling to all wicked men. Listen to those musics, making you feel better than ever before, my guys. So every Friday, you know what we do? We do it mental health rejuvenation. So welcome everyone. Thanks for support. It has been 1.5 hours of pure niceness and talking about conditions. Be blessed, everyone, and let's have another session tomorrow. Share my videos and interaction. Whoa!